Well, my head is swimming a little bit. I had used Ian data for a couple of projects and had no idea that it was now connected up with all these other wonderful things. I hope there's more opportunity to digest some of that information. I want to drill down a little bit more to the end user and how are data sets being actually used by people to make decisions either about individual children or the adoption of evidence-based practices. And when we had a call a few weeks ago, we were thinking, it was all kind of interesting of why was I asked to be on this panel? Is it because of this? Is it because of this project? And I've known Hendrix for a while, and it's nice to be provided the opportunity to come in and talk a little bit about what we've been doing. I do work mostly in school settings, and I have a couple of jobs these days, as many of you all do here in the room. I have an administrative position at the University of Virginia in the School of Education, which somebody told me it was good that I actually had a job in an education school at some point since I studied schools so much. But I've been working for about 10 years at Johns Hopkins in the School of Public Health, and so I still have an appointment there and spend a lot of time going back and forth between Virginia and Baltimore with a lot of stopovers in DC. So I'm going to talk about two federal initiatives that have been going on in the field of education to give you a little bit better idea about how some data are being collected around children's behavioral mental health and academic performance, obviously, and how that can be actually used by real live people. This work is in close collaboration with the Maryland State Department of Education, and it was very fortunate that you heard from Ann Sheridan this morning, our Governor of Office for Children, as the Executive Director. You got a little bit of a landscape of what's going on in Maryland around database decision making. This isn't just happening in the governor's office, but is actually happening in the State Department, and even drilling down to the expectations for individual schools. Shepherd Pratt Health System is a very large nonprofit mental health provider across the state, and what's even great about them is in addition to providing a continuum of care around behavioral mental health, they actually have a strong and authentic commitment to prevention. They have several sites across the state and provide a lot of supports to kids with autism, but also do a lot of school-based work as well as individual mental health care. So a lot of our work in Maryland has focused on a framework that builds on a multi-tiered systems of support. That's the broader umbrella term that's often used to try to get at this tiered prevention framework that many of us in public health have been using and cite all the numerous IOM reports that many of you in the room have contributed to. In school settings, we often hear the term positive behavior support, which brings in a little bit of a behaviorist orientation, but still builds in different systems and practices that are all guided by data. The application in school settings around positive behavior support was developed by Hill Walker and George Sagai and Rob Horner and others, with a lot of funding, in fact, from the Office of Special Educations at the U.S. Department of Education. And so this data systems practices framework is this is one of these magnets that we kind of hand out at all of our conferences. I'm going to focus more specifically on the data elements today and not cover all of them, but just give you a glimpse about the framework that schools are using in this multi-tiered approach. But there are certainly changes about the way schools are collecting data and the way they're making about decisions in terms of who actually gets support services, in many cases using a response to intervention type of framework. And then there are individual programs or practices that can be brought into this framework if you're interested in social emotional learning, for example, or if you're interested in preventing substance abuse, you can build it into that tiered framework. And that's why you see a lot of triangles on a lot of things, because it really maps on to the public health approach, acknowledging, according to theory, that about 80% of kids are going to be in that level of support where they need more universal and actually respond to universal interventions, and then about 20% fall into those selective and indicated levels. And as you know, as we work our way up the triangle here, the level of intensity of support services, as well as training and dollars and actual time to implement interventions, often increases. And so many of the schools do a pretty good job getting those universal levels of supports in place that are used school-wide, like classroom management strategies. But when they say, Johnny's not responding to that, what do I do? Or what does it look like to not respond to a classroom management system? Where do I actually direct them, or what kind of services? That's where a lot of the more intensive mental health comes in, and this is where a lot of the database decision making needs to come in about how do you identify those kids that are non-responders, what are they non-responding to? Is it behavior? Is it academic? Is it emotional? And what do you actually do with them, and how do you progress monitor? So you can see how this framework is just a general model for how schools are approaching addressing behavior as well as academic concerns. This triangle has been used a lot in academic for a long time, but now more recently brought into the behavior and the mental health. The state of Maryland, we've been working on 2 related initiatives using database decision making under the broader positive behavior support framework that I want to hone in on today. We certainly have a whole mess of different projects, but I wanted to narrowly focus on 2 active projects that we've been collaborating on. And the first is called the Maryland Safe and Supportive Schools Project, that includes all 3 partners here at Johns Hopkins, Sheppard Pratt, and the Maryland State Department of Education. And it was funded by the U.S. Department of Education. We were one of 11 states to receive a grant. We got $13.7 million, which was pretty nice. And then we got the William T. Grant Foundation to throw on about $1 million more, so that way we could collect some observational data. So just under $15 million to be able to focus on high schools. And I actually trained as a developmental psychologist and have always been very interested in development across time and understanding different types of interventions that are needed and developmentally appropriate for kids. We had 3 broad aims. One is to improve the school environment, cut down on things like violence and bullying, substance use, and improve connections among youth. And we used a broader framework around school climate. And so that's often one term that you'll hear me use to talk about this whole bundle of things, because schools feel a little bit more comfortable talking within a climate framework than mental health per se. Another initiative that's very relevant to our conversation today is essentially we were asked to develop a surveillance system to guide the decision-making process. And we decided to put this on the web and make it an anonymous survey system that was available to students, parents, and staff. And I'll talk a little bit about that process. But it wasn't supposed to be a flash in the pan. It was supposed to be a sustainable system that the state would actually adopt. So not only were we collecting data in the context of this particular project, but we had to actually build a system that would be sustainable and to try to get them to come and not go away after the 5 years of the funding. We technically had 4 years, and we're in a no-cost extension year right now. And we have a continuum of evidence-based programs I'll talk a little bit about, where schools were allowed to select across a menu of different evidence-based practices to build within this framework. Because we have a good research partnership, we decided to do this within the context of a randomized control trial design. So we enrolled 58 high schools in this trial, and we have since expanded the initiative to include about 200 schools across the state, and just got additional funding from National Institute of Justice to do a similar trial at the middle school level because of our promising impacts. But we are in our final year of data collection at the high school level, where we did do random assignment. And in terms of what did we randomly assign on, we were very interested in how do we improve the school climate in these school settings, and wanted to provide schools access to data that would help facilitate their decision making in that direction. And we used the U.S. Department of Education's model of school climate. And those of us that spend a lot of time thinking about climate, sometimes people get very focused on, well, it's just perceptions of the environment. It's nothing about behavior. But we were very interested in the behavior because, for example, bullying. I was actually part of an IOM workshop a few months ago on the topic of bullying, and we see such a tight connection between the climate and bullying. Am I feeling less safe at the school because I see a lot of other kids get bullied? Yeah, but I'm also getting bullied, so I feel less safe. So my personal experience or the behavior that I'm engaging in, either as a victim or as a perpetrator, contribute to my perception. So teasing them out and saying one is the cause and the other is the consequence is a little bit challenging. It's a bit of a circle here. So that's why we included indicators of actual behavior. You could make a similar argument about substance use. I don't feel very connected to the school because I'm using a lot of drugs. Or I don't feel very connected to the school and I use drugs as a result of that. So a lot of these are really tightly connected, which is why we made, I think, a pretty compelling argument that we wanted to have perceptual data as well as behavioral indicators. And also behavioral things are important for us to try to move. So you'll see 3 different areas: safety, engagement, and environment. A lot of our behavioral indicators fell under safety, but we also spent a lot of time talking about connectedness, feeling connected to others, to the school environment, and to adults. And we know from a long line of work that this is very important. So you see a lot of the risk and protective factors that we're trying to address within the surveillance system. And as I said, the schools in the intervention condition got access to a coach, which we called a school climate specialist. They did not provide individual services to students, but more about the adoption of systems and frameworks around the use of the data and the selection of evidence-based practices. We had this tiered framework, so the schools in the intervention condition were all doing the universal elements of positive behavior support, and we're expected to use the data, and you'll see some commonalities between this type of framework and a communities that care framework, which I assume we're going to hear a little bit from Rico about tomorrow. But this is really focused on just the school environment, didn't have a community piece, and we had a narrower band of evidence-based practices that they were able to select from across the tiers. Punchline is interesting here that most of our schools across the trial got trained in different elements, but really the uptake was largely at that tier 1, implementing positive behavior support and choosing one of the tier 2 interventions. They got very excited about doing other programs like the Olveus bullying prevention program, but very few were actually able to launch those efforts with fidelity. So at the end of the day, we're largely looking at a randomized trial of positive behavior support with training at tier 1 and tier 2 without a lot of tier 3 types of interventions. In terms of our trial design, we have a number of indicators of fidelity, observations of the school environment, as well as these surveys. I'm going to focus more specifically here on the surveys because that's relevant to the development of the sustainable system. We're collecting data via a web-based survey system. We have a sampling approach, about 25 classrooms per school. We're all in high schools in this project. It takes about 20 minutes for our students to complete. We are using an anonymous and a voluntary system. Our state has approved a waiver of active consent, and we do it annually, and we have items derived from different survey systems that allow us to do some comparisons. And all of our data elements map onto these 3 core features. We wanted to be true to that framework. We actually have a youth advisory board that came up with the slogan, "These are not real children, these are not our real advisory board," but these are posters that the kids selected to actually post in their schools. So we wanted the survey system not to be a surprise, but something they actually felt bought into. So they came up with this slogan of, what kind of school do you want your school to be? And we actually do have real live Maryland children who are videoed, and they show up at the front of the survey system trying to get buy-in for the data collection. The survey data isn't just captured and whisked off to Johns Hopkins, but it's actually in the survey system that's available in real time for administrators. And we developed a number of different reports that are automatically available to them. An executive summary that's very short, the kind of just the facts, ma'am. We have a quick report that's quick in the sense you hit a button, but then you get all of this data spit back to you from parents, students, and staff. We have an advanced report where you can actually sort and say, what do my 9th grade African American boys look like in terms of their rates of victimization by peers? And then we have comparison reports across years. We started off in high schools, in the 58 high schools, expanded into middle and elementary schools as part of this phase pilot, and now have over 200 schools in the state that are using it. Not all of them are in the trial, but we have a broader data collection effort. We are doing observations to try to validate this and give another source of data back to the schools, so that way, what does it look like in terms of school climate? And so we have 2 other measures that we're using. I won't go into detail on them here, but we are in the process of validating them in conjunction with the self-report data, and I'll be happy to go over. We collect them with handheld devices, both in classrooms and non-classroom environments across the school. Now, I want to jump to another project very quickly that's around Race to the Top. So this is another data dashboard that we developed more generally within the context of Race to the Top, which you're probably familiar with from the news. Maryland was one of the sites, and one of the requirements was to develop a data dashboard. So we were contracted with them to work with Judy Kowarski at MSDE, the Maryland State Department of Education, to develop a data dashboard system using this positive behavior support type of framework. So now we're shifting away from survey data to just data that the State Department has over the past several years. They were very interested, can we predict graduation and dropout? How can these types of indicator data be used by principals that are part of the Positive Behavior Support Network, as well as other schools? But they've already trained about 1,000 schools in positive behavior support. So we've got a network of schools that are thinking about data systems and practices, and launching another data dashboard through that network is very helpful to give them a framework for thinking about other kinds of academic outcomes. So we received data from the State Department, about 60,000 up cases that we observed across 3 different cohorts. And the cohort design was largely based on when the state adopted its current standardized tests. They're actually moving over to Common Core now, so we have some challenges ahead. But our outcomes of interest were largely about retention, so being retained a grade, essentially failing a grade, not moving on, and then ultimately graduation and dropout. And they wanted us to look at 19 indicators that we had that were available to us. And you'll note, looking over this list here, you don't see any demographic information. They were very intentional that they didn't want to get some kind of racial profiling data set back from us. So we actually, in most of our models, were not allowed to include any demographic characteristics because they didn't want that to suck up the variance. They did not want any kind of profiling type of model as it relates to demographics. When we do throw in the demographics, it improves the fit of our models because we're accounting for more variance, but we did not want it to be based on those indicators. We also wanted modifiable. So this is some of the information about different risk points across the 19, and you'll see we use the tiered colored framework because it provides a heuristic of green is probably doing pretty well, yellow are at-risk kids, and red are ones that have a lot of risk factors. And so on the left-hand column, this just shows you the number of risk factors. So you see as we get down to 19, what number of kids across this data set of about 67,000 students actually had 19 risk factors. Well, it was just 2 within the column of kids that did not graduate. So you really are seeing a relatively long tail of the distribution. Most of your action from a risk decision-making standpoint is at that 3 or more type of risk factors. And so just to give a little bit more information, we calculated hit rates, which essentially are the second column of the 89 divided by the 17,000, so that's about 1%, as well as looking at percent of students identified. So if your kid has 0 risk points on this 19-point scale, they're probably not going to not graduate from high school. So, but then when you're a principal and you start thinking, all right, we've hit 3 or more of those, we've got to get on this kid and start thinking about ways that we can support them. And that also varies by the child's age. So for example, where do you get the strongest prediction? We're really finding around that 8th, 9th grade transition that cut point is really closer to 1 risk factor. But by the time you make it to 12th grade, there are fewer. If you're going to make it to 12th grade, you're pretty close to graduating, so those risk equations vary across age. So this is just give you a snapshot of what we've been looking at in terms of the data dashboard. I told you they asked about other types of indicators like retention. We actually found our models fit best for the not graduating, which is different than graduating and dropping out, I will remind you. But the not graduating outcome, that was actually our model that fit best. It didn't fit as well for the other types of outcomes. And things like retention and high school achievement tests were the best predictors. In terms of wrapping up, pulling these 2 examples of database decision making together, we found a couple of common themes, and in fact these map onto some of the similar themes we just heard about how do we frame the data use. You heard me talk about climate or predicting dropout. The kind of outcomes that are of interest to schools are the ones that they're going to uptake. Quite often they are concerned about issues about behavior and emotional and academic performance and may not be thinking about mental health. Predictive modeling, so we have been using what does it look like to be a non-responder to positive behavior support, and what are the surveys, how well do they help us predict who's going to need a tier 2 or tier 3 kind of intervention. And then incentives for data collection and use. So what is the punishment as well? Where's the carrot as well as the stick for collecting and actually using that data? And I thought about putting on my slide, literally, just building it means they aren't going to come. So we can track on our survey systems how often they log on and use the data. And having a school climate specialist does, frankly, increase their likelihood of using the data. And then providing training and a framework for using that data. Just because you build the system doesn't mean they're going to actually know how to use it. And so you need to provide training and support around that process. So that's it.